My History of Britain in 100 Objects item is the throat pastilles from the Bliss Hill Victorian Town by Tegan Elliott. Primary source is a box of throat pastilles. The physical appearance of the box appears to be banged up with bits of rust while still being legible and still in bright colors. On the box in the top left-hand corner, we can see the orange triangle with the brand Monsell. In the next row below, we see printed ingredients such as menthol, dextrose, and sugar base. The row beneath that, we see the instructions, which state one to be dissolved slowly in the mouth every 4 hours or taken as a physician may direct. The row below includes the branding with the address and the company's address below. And while this item may be over 100 years old, it is still in decent condition. The throat pastilles relate to the regional identity of those who would use them. In a small rail town, there would have been lots of work for little money, not providing the time or income to be sick. Throat pastilles were an over-the-counter solution for sore throats. At the time in Britain, there was a lack of collective regional identity. As Passy said, narratives on our regional identity become constituents of the interpretations of what the identity is and what it means. With poverty being an issue at the time, Brown reminds us to never forget the queues outside the poor relief offices and the dissolute people. At the time, there was no universal health care, which meant personal responsibility when it came to prevention of diseases, and if doctors' visits were required, they were very expensive. Due to the lack of highly trained physicians and the high cost to visit them, many turned to chemists or apothecaries at the local pharmacies for more available, cheaper options. Chemists would provide free advice on what products to buy for certain symptoms. As Omega RRS says, the low number of elite physicians meant the public were turning to apothecaries as a more readily available and cheaper alternative. Pharmacies were commonly found in the majority of towns for the purchase of medical supplies and other remedies. At the time, many were left working jobs with poor working conditions and long hours, leaving many feeling sick without the money or time to see a doctor. As a result, the pharmacies were a good, cheaper option. Nonetheless, on July 5, 1948, when the National Health Service was created, free healthcare was made available to all British citizens. As a result, this allowed all British citizens to have access to free healthcare without payment up front, leaving throat pastilles as a way to help people feel better.